Venepuncture means insertion of a needle into a vein in order to withdraw blood for laboratory analysis.
Hello, I am Dr. Kolitha. I am going to demonstrate the correct technique of venipuncture for you to learn and practice.
Let us see the possible sites for venipuncture. The antecubital fossa of the arm is commonly used. The veins in this area include the cephalic, median cephalic, median, basilic, and the median cubital veins. The other important structures in this area are the brachial artery, median nerve, and the tendon of the biceps muscle. It is important not to damage these surrounding structures. If no vein is found in the antecubital fossa, it may be necessary to use veins in other sites, such as the wrist, hand, leg, ankle, or foot, or to perform a capillary puncture. Before performing venipuncture, it is important to make sure that all the equipment needed are at the site. Items needed for venipuncture are gloves, tourniquet, syringe and needle, gauze pads or cotton balls, antiseptics, commonly 70% alcohol, plaster, a discard bucket, and a sharps bin. The tourniquet is a piece of rubber or rubber tubing sufficient to go around the upper arm. The syringe is composed of two parts, a barrel and a plunger. At the distal end of the barrel is the nozzle. The barrel and plunger are manufactured to fit together tightly. Syringes to be used should be selected according to the volume of blood needed to be drawn. The needle used in venipuncture is composed of three parts: the bevel, the shaft, and the hub. The bevel is the sharp angle cut end which enters the vein, followed by the shaft which gives the needle length. The hub is the portion of the needle which is attached to the syringe. Adjust the needle so that the bevel and volume gradation on the syringe are aligned. The syringe and plunger should also be tested. The request forms written by the clinician should contain all information about the patient, such as name, age, physician's name, a brief clinical history, suspected diagnosis, and if an inboard patient, hospital identification number, room number, as well as the lab tests which were ordered. Approaching the patient. There are three major steps in approaching the patient before performing venipuncture. They are correct patient identification, explanation of who you are and what you are about to do, reassurance of the patient that the procedure is routine and will not be damaging. The patient should be placed in a comfortable position, which is also comfortable for the person performing the venipuncture. The tourniquet should be placed above the site of venipuncture. When using a vein in the antecubital fossa, it is placed around the patient's arm, midway between elbow and shoulder. The tourniquet should be just tight enough to cause the veins to enlarge, but not to occlude arteries. Palpate the area to feel for the veins. If the patient opens and closes his fist a few times and then clenches his fist, the veins will often become more prominent and easier to locate. If no adequate vein is found in either arm, it may be necessary to briskly but gently slap the antecubital fossa several times. Never, on blind chance, try to enter a vein which you can't see or feel. Now let us see the procedure in performing a venepuncture. Put on the gloves and clean the venepuncture area with a gauze pad or cotton ball wetted with 70% alcohol. Remove the needle cover and quickly inspect the needle tip. Discard blunt or bent tip needles as they may hurt the patient and damage the vein. Hold the syringe with the thumb on top, fingers underneath. The needle should be pointing parallel to the vein. The vein should be anchored during the puncture by placing the left thumb about 1 inch below the puncture site and stretch the skin with the thumb and index finger. Introduce the needle under the skin, keeping the bevel up. The needle should enter the vein at a 50-degree angle with a single direct puncture of skin and vein. Appearance of blood in the nozzle indicates that you have entered the vein. Pull back gently on the plunger without altering the position of the needle until sufficient blood is collected. When the desired amount of blood has been obtained, release the tourniquet. Cover the puncture site with a dry cotton ball without applying pressure and quickly withdraw the needle. Immediately apply pressure to the puncture site. Instruct the patient to apply pressure to the area, preferably with his arm up for 2 to 3 minutes. Inspect the puncture site after 2 minutes. If the bleeding has stopped, a piece of plaster may be applied. Occasionally, a patient may not stop bleeding readily due to disease or medication. In such a case, continue pressure for 5 to 10 minutes. If bleeding still continues, seek advice from a senior colleague and do not leave the patient until the situation has been resolved. It is necessary to remove the needle from the syringe before transfer of blood into tubes. Used needles and syringes should always be disposed in specially designated containers and not in the patient's wastebasket in order to prevent accidental injury and spread of disease. Run the blood down the inside of the tube slowly to avoid destruction of red cells. When performing the transfer in this manner, use very gentle pressure on the plunger of the syringe to avoid splashing the specimen on the bottom of the tube and possible expelling it from the tube. Tubes containing anticoagulant should be gently mixed to ensure adequate mixing of blood with the substance in the tube. Do not shake the tube as this could cause lysis of red blood cells. After proper disposal of venepuncture equipment, remember to wash your hands before leaving the patient's room.